Hello, everyone, and welcome to another episode of the Aunty Pharmacist podcast. Yes, it's TGIF. So, today I want to discuss something hilarious. Maybe not particularly hilarious, but pertinent. I think that's the right word. Yeah, pertinent. It's important to discuss at this time. When you saw the title of this episode, what did you think? Were you like, what does this even mean? Well, you will get me in a bit. I'm almost sure the situation I'm about to discuss happens in many pharmacies nationwide. At least, it does in my pharmacy. And I don't like it, which is why I brought it here. Many patients do not live up to their names. I don't know who came up with that nomenclature, patient, for people visiting a hospital or clients or customers of a pharmacy, but I'm very sure they have their reasons. I'm also sure that we all know the literal meaning of patient. It simply means to be gentle, waiting without rushing for something to happen. You know this, right? You're getting the direction of my thoughts now, Abby. Many of my colleagues will agree with me that most patients are not patients, especially when they get to the pharmacy. I understand that some must be coming from the hospital after spending a long time waiting there, and most likely are already frustrated. But it would be nice if they can maintain that patience when they get to the pharmacy. At least they should maintain the patient fine. Totally. Note that I said that roughly 70% of patients that come into the pharmacy haven't even been to the hospital. So I don't understand the rush. They want to breeze in and breeze out as if it's a drive-through. The annoying thing is that some will be in a hurry out of their own making. Maybe they didn't pack well, or maybe they left their children in the car, or they are keeping bikes or cabs waiting for them outside. Then they start hurrying the pharmacist up. Some will see the pharmacist obviously attending to someone else, and they'll be talking, asking for medications and all. Even social etiquette, common courtesy demands that you don't interrupt people's conversations, not to talk of demanding that you should be attended to while someone else is being attended to at the same time. It is no news that pharmacist to patient ratio is not ideal, even anywhere in the world right now, not to talk of Nigeria. I listened recently to a podcast of a pharmacist in the US who was saying the same thing. So you can't expect me to attend to you at the same time as another patient. This patient also deserves my utmost attention, just as you do, and I can't divide myself into two, you see. So it's either you wait for your turn or leave and come back again when you're not in a hurry. Honestly, that's the truth. Except in case of emergency, do not expect to be attended to while the pharmacist is busy with another person. Please wait your turn. Your waiting time at the hospital is for a reason, as there are protocols to follow. So also are there protocols to follow in the pharmacy, in case you don't know. If you're coming in to demand for a drug, I have to get the name of the drug right first. Make sure that I am handing over the right medication to you with the appropriate dosing instructions and counseling information before you leave the pharmacy. So you have to be patient. If on the other hand you are coming with a prescription, I have to interpret it right, identify any drug therapy problem, get you the right drug, label appropriately, and verbally communicate the dosage and any other counseling that should accompany the medications to you. If this prescription contains a prescription only medications, there are documents to be filled, there are documentations to be done, there are signatures to append before the medication is even handed to you. You have to wait for this. Now, also, if you are coming in for consultation, you have to be most patient because there are several questions I must ask which you are expected to provide answers to in order to guide me in giving you the appropriate medications for your condition, followed by all the other things I have listed previously. So you see, you must live up to your name, patient. Hurrying up the pharmacist will be detrimental to you because any error made by your pharmacist in dispensing will directly impact you and not necessarily the pharmacist. Although, if life-threatening or health-threatening, God forbid, that may lead to the pharmacist losing their license to practice or worse, ending in prison. but may we not see that one? So, you see, this profession is too sensitive to be done without proper care. I can't, because you are hurrying me now, go and put myself in trouble. It's better you wait and be patient so that you can be attended to properly. It doesn't even matter if you are getting a single sachet of medication. Just wait for your turn and you get it. The pharmacist is the last point of call before your medication gets to you. So no error is permitted or the patient suffers for it. Pharmacists are smart people and we will not deliberately waste your time unnecessarily. I need you to know this. No matter how little what you want to get might be, you have to wait for your turn unless it's an emergency. When I say emergency, something that is life-threatening. Maybe somebody needs an inhaler fast because they have an asthma attack. Maybe somebody is breathing profusely and needs first aid before you get them to the hospital. I'm not saying that when you rush in and say, it's an emergency, I didn't pack well. It's an emergency, my children are waiting for me in the car. That one is not emergency enough, please. Because emergency has to be defined in this case. People have different meanings for emergency in their own dictionaries. You can't go to the ATM and jump the queue because you only want to withdraw 1,000 naira. So the same thing, because you want to get just a sachet of paracetamol maybe, and you see this pharmacist discussing with another patient about their condition. Now running, give me one sachet of paracetamol, and you expect somebody to listen to you. Please wait for your turn. If you can't wait, leave and come back at another time when you have time. Be patient. So by now, you understand why you have to be patient, as your name implies. My dear patient, live up to your name. On that note, I bring today's episode to an end. Please do well to share this episode with as many people as possible. Follow and subscribe to this podcast as well. Also, follow us on all our various social media platforms, on X, on Instagram, and the likes. You can also reach us via our mail, as we usually say, auntypharmacistpodcast@gmail.com. Suggest topics that you want to listen to, and we will be sure to bring it to you. Enjoy your weekend, and I'll see you on Monday. Till then, stay healthy and God bless you.